The Joker is one of the world's most beloved supervillains and has been reinvented many times over, leaving destruction in his wake wherever he goes. Today we'll look at some of his most infamous scenes and multiple interpretations of the character to see what the Joker has to teach us about human anatomy. Please note, every moment where the Joker acts in a not so nice manner is contextualized within a lesson and shown for educational purposes only. Interns, buckle up your seatbelts. We're off to an explosive start. Luckily, the patients at Gotham General were evacuated before the explosion occurred. That's a relief, since this hospital is known to be the most prominent healthcare institution in Gotham City, which has a population similar to that of New York. Even more by some accounts. For reference, the largest hospital in New York is said to be the New York Presbyterian Hospital, with something like 2,455 beds. Targeting a hospital, potentially with thousands of people sick and injured inside, not to mention the nurses, orderlies, doctors, and other medical staff who support them, is a truly heinous crime. If not for Gotham PD and a speedy evacuation, the damage would have been catastrophic. The Joker is only getting started.
Give me one reason why I shouldn't have my boy here pull your head off.
How about a magic trick?
Now, do I really need to introduce this scene? As any of you who are familiar with this film already know, our friendly neighborhood Joker is going to give us an unforgettable lesson in cranial anatomy. Sleight of hand, so quick that even the videographer has trouble keeping up.
It's
Looks like the pencil, approximately 8 inches in length, entered the henchman's skull via the right eye socket. The eyeball, which is made up of 3 layers, which we refer to as tunics, will unfortunately be crushed and crudely penetrated under the force of the pencil, which is eraser side up. The outermost layer, known as the fibrous tunic of the eye, which is composed of the sclera and the cornea and formed from dense connective tissue, protects the eyeball to some degree, but the structure is not designed to withstand forces like this. The eye socket is a bony cup that surrounds and protects the eye. And while the rim of the socket is made of fairly thick bones, the floor and the nasal side of the socket is paper thin and in many places offering little resistance to the pencil. Directly behind the eye, the optic nerve will definitely sustain damage before the pencil penetrates the temporal lobe, cerebellum, and possibly even the brainstem, depending on the exact angle of penetration. More than likely, the result here is a gruesome progression of events. Through a globe rupture, a fracture of the posterior aspect of the orbit, penetration of the cerebral matter, to subsequent intracerebral hemorrhage, and a rapid cessation of lower brainstem functions. You know, the ones that keep you alive.
Oh, and by the way, the suit, it wasn't cheap. You ought to know, you bought it.
Shit.
Yeah, I'd be angry too, but not nearly as angry as Batman after this next clip. That is indeed a crowbar to the chin from the 2011 film Under the Red Hood, which was adapted from the 1988 comic A Death in the Family. And while I understand that Jason Todd has had extensive combat training and has a high pain tolerance, the scene really forces me to suspend my disbelief, since a blow powerful enough to send a person flying backwards would be sufficient to crack the mandible or zygomaxillary complex, break the skin, and even leave the victim unconscious or grossly disfigured. The way the Joker lifts the crowbar above his head suggests the initial impact may have been made with the bent claw tip, which would concentrate the force in a smaller surface area, increasing the likelihood of both laceration and broken bone. By now, we know Jason has sustained at least 2 blows to the head or neck region, although there could have been more. Again, I would expect some combination of broken mandible, zygomaxillary complex, and orbital bone fractures, some of which are likely to be open, colloquially known as compound, or in other words, face soup, along with a concussion or more severe closed head injury at the very least. As the Joker carries on, he targets various parts of Jason's body, including his torso, his neck, his head, or all of the above, since damage to all of those locations could explain why Jason has difficulty speaking here. Aphasia is a sudden inability to speak, usually happening suddenly after a stroke or head injury, as could be the case here if Jason has sustained damage to the areas of the brain associated with language. Broca's area, which controls speaking ability, and Wernicke's area, which controls word selection and understanding. In addition, an injury to the trachea, the cartilaginous airway that leads to the larynx or the voice box, to the bronchi in the lungs, could also impede Jason's ability to speak. NIH tells us, overall, a tracheobronchial injury is relatively uncommon in blunt trauma. However, the majority of tracheal injuries are due to blunt trauma, including direct blows, compression or strangulation, and shearing injuries. For example, a clothesline. I wonder if a crowbar will suffice. Both of the above mechanisms would make speech impossible, but each by a different method. An inability to speak caused by a software issue rather than a hardware problem. Either way, the Joker has different ideas.
A little louder, lamb chop. I think you may have a collapsed lung. That always impedes the oratory.
A collapsed lung or pneumothorax occurs when air leaks from the lung and begins to fill the pleural space between the lung and chest wall. This buildup of air puts pressure on the lung, so it cannot expand as much as it normally does when you take a breath. A 2020 article from the Chinese Journal of Traumatology offers more detail. Pneumothorax can occur in blunt chest trauma in 4 mechanisms. 1, alveolar rupture due to increased alveolar pressure. 2, a paper bag effect, which occurs if the epiglottis is closed during sudden pressure increase in the tracheobronchial tree. 3, acceleration and deceleration injuries. And 4, rib fractures damaging the pleura.
I have to warn you that it can cause internal damage. It could cause your heart to explode, crack a sternum,
But while this injury is commonly associated with blunt force trauma, it is usually possible to speak even with a collapsed lung. Just ask Hogan Reed, a young woman living with cystic fibrosis who has survived 2 collapsed lungs. I could still breathe, walk, and talk when one lung was collapsed. I felt chest discomfort, tightness, shortness of breath, shoulder pain, and exhaustion. It should be noted though that speaking may become more difficult over time as pressure builds up inside the pleural cavity. No matter what the cause, Robin doesn't need speech to get his message across.
Now that was rude.
Unfortunately, Jason's time has almost run out as Joker locks him in a warehouse with a sizable bomb and a frantic Batman arriving just a little too late. Much like the crowbar earlier, the physical damage that could be caused by Jason's proximity to an explosion of that size has been downplayed somewhat. Suffice it to say that we would expect to see Jason in much worse shape than he is. You know, with the blast, flames, debris, falling infrastructure and whatnot. But let's leave Batman to his grief. I won't belabor the point anymore. Not while there are other medical miracles afoot that cause me to suspend the living heck out of my disbelief.
They want to see your face.
Here we have Jerome Valeska, one of the Jokers in the Gotham TV series. He is deceased as of this moment, but not in the hearts and minds of the downtrodden people of Gotham. And so Dwight, the man holding the scalpel, removes Jerome's face so that it can be worn as a mask to satisfy the mob outside.
Where's Jerome?
As you'll see, he doesn't stay dead. But for the sake of time, we're going to gloss over the resurrection and talk about what happens to his face.
I can feel my face when I'm with you.
This scene harkens back to one of the most horrifying versions of the Joker ever to grace the pages of a comic. If you think otherwise, be prepared to back up your choice with an explanation in the comments section below. In the November 2011 issue of Detective Comics #1, Joker, after being sent to Arkham Asylum, enlists the doll maker to remove his face, which he later wears as a mask, proving that he has reached a whole new level of insanity. Like, muy loco, bro. Whether in the comic or on screen, there are some people for whom a faceless Joker is just too far-fetched. So I've taken it upon myself to determine just how far this version requires us to suspend our disbelief.
What's that? This guy's hilarious.
The skin is the largest organ of the body, tasked with keeping moisture on the inside and contaminants such as bacteria and microorganisms on the outside. Any large amount of exposed subcutaneous flesh, like say a missing face, is literally a football field-sized hole in this continuous protective barrier. A hole this size would increase the risk of dehydration and infection many times over. Now, you could live without a face, with the muscles and tendons exposed. Granulation tissue, new connective tissue, and microscopic blood vessels that form on the surfaces of a wound during the healing process would form on the surface to fill this wound. This is what we call secondary intention healing, and sometimes when a wound heals this way, skin can grow over top, but more likely it'll be scar tissue, similar to what we see with burn victims. Alternatively, primary intention healing refers to a wound where the skin edges can reapproximate easily, as in when a surgeon sews up a wound or laceration. Believe it or not, a full face transplant is an available treatment option for some people with severe damage to their faces or severe visible deformity. This procedure may replace all or a part of the face with donor tissue from someone who has died. This is a delicate procedure which can have incredible results when successful. But that is not this. The comic betrayal was even more crude. The face held on with hooks and a belt. In both renditions, the color is a ghastly white. Terrifying, but inaccurate. Unless the face was suspended in some form of preservative medium, tissue that is not oxygenated will start to die within 6 to 8 hours. First, the cells within the tissue consume whatever oxygen remains within the blood in the tissue. As this occurs, the skin will transition from light pink to a slightly darker mauve color. After 8 or so hours, necrosis begins. That is to say, the death of body tissue, and the color transitions to black. Fastening necrotic tissue onto an open face wound is an invitation for all types of infection and potentially even widespread sepsis. The bacterial content in dead tissue is far higher and only increases as time progresses.
How's it look? It's good. It looks good. You wouldn't lie to me, right?
With that in mind, any Gotham fans watching this video want to help me out with the timeline? Was the tissue reattached in a quick enough fashion to permit some amount of healing as pictured here? And hey, if the reattached look is too far-fetched for you, Joaquin Phoenix's version of the Joker is grounded a little more firmly in reality.
It's been a rough few weeks, Murray. Ever since I killed those 3 Wall Street guys.
The story of Arthur Fleck as the Joker has all of the fantastical elements stripped away and presents a man with mental illness pushed to the breaking point by circumstance and society.
What do you get?
I don't think so.
When you cross
I think
a
we're
mentally
done
ill
with
loner with
That's
a
it.
society that abandons him and treats him like trash!
Like the themes the movie addresses, the crimes Arthur commits are raw and presented in their unadulterated form.
I'll tell you what you get! You get what you deserve!
Whoa, whoa, whoa. We've all seen what happens next, but in the spirit of building my business online, I'll forego the gory footage and instead briefly touch on the anatomy of a headshot.
On the surface, yes, a headshot is a fatal wound, but beneath the gory reality, there's a lot that goes on when a bullet enters someone's skull.
Shout out to the Dark Science YouTube channel, which posted a great video on this topic. We'll see more from them in a minute. Earlier in the film, Arthur is shown loading his firearm, a 3rd generation Colt Detective Special, which is a 6-shot 38 caliber revolver, if I am not mistaken. Though perhaps someone with more knowledge than myself can identify the ammunition in use in the comments. Any Flannel Daddy fans? Either way, at such a close range, both hollow point ammunition, designed to expand within flesh, and full metal jacket ammunition, which retains its shape, could pass through the skull, leaving entry and exit wounds in their wake. The difference in size between entrance and exit wounds is explained succinctly by Dark Sciences here.
This is because as the bullet passes through the medium, it creates a shockwave in front of it which widens.
On impact, the bullet transfers kinetic energy to the target, slowing down as it does so. Bullets with a higher surface area, or bullets that expand, transfer their energy faster, slowing more quickly, which increases the likelihood they will become lodged in the tissue. In regards to a headshot, the main tissues a bullet will encounter are the skull and brain tissue. On one hand, the skull is very hard. On the other, the brain is composed of 60% fat, while the remaining 40% is a combination of water, protein, carbohydrates, and salts, which offers little resistance to a passing bullet. The bullet may lose significant energy entering the skull, but loses much less as it passes through the brain, in some cases leaving it with enough energy to exit on the other side, as Arthur so chillingly demonstrated for us. As the bullet rips and tears through tissue, it leaves a path behind it, proportional to its size, known as the permanent cavity. This interaction creates a pressure wave that temporarily expands tissue outwards, the temporary cavity. But brain tissue, due to its fatty, gelatinous structure, is less elastic than, say, muscle.
Solid, inelastic organs like your liver, pancreas, kidneys, heart, and brain receive full damage from the pressure wave because the tissue does not stretch.
Correct. Even so, this is not necessarily a 100% death sentence, and there are many stories of people surviving gunshot wounds to the head.
Like 5 bullets just came through the vehicle, and the 5th one struck me in the back of the head.
But they are among the lucky few. A 2019 study in trauma surgery and acute care, which included 825 patients sustaining gunshot wounds to the brain from 25 trauma centers, showed that only 2.1% of patients, 17 in total, survived to discharge. That's really not that many. I wonder what the Joker from the Dark Knight trilogy thinks about all this.
Guns are too quick. You can't savor all the little emotions.
And yet, instead, he's opted for an improvised explosive device, as we'll soon see.
What's that? He's got some kind of a contusion.
I always found contusion, which is the medical term for a bruise, to be a little bit of an unrealistic assessment here. We can clearly see the marks of a very crude laparotomy or surgical incision into the abdominal cavity. This is typically performed to examine the abdominal organs and aid in diagnosis of many problems, including abdominal pain. But obviously not in this case. Contusions generally aren't that rectangular, so this injury reeks of human intervention.
I just want my phone call.
And then, upon placing the call,
Is that a phone?
not a lot of savoring the moment there, but I suppose desperate times call for desperate measures, and the Joker needing to escape captivity and all. Now, I'm not an expert on improvised explosive devices.
What happened? I don't know, it just didn't explode. That's weird.
But I wonder what size explosive would be necessary to create a blast of that size, because there isn't a whole lot of space in the abdominal cavity. Granted, this region contains many vital organs such as the stomach, the small and large intestines, the liver, spleen, and kidneys, to name but a few, all contained within a membranous sac called the peritoneum, that a person could live without for a very short period of time. Perhaps the Joker removed a portion of the small intestine or the liver, which would free up about as much space as a football. And while you can't live without a working liver, the Joker's intention was never to keep his bomb carrier alive. No, sir. He just needed a way out so he could keep tormenting Batman and his precious Gotham. Pop quiz. Which version of the Joker do you prefer, and what is your favorite scene? If you are interested in learning how to train for health and mobility in a sustainable manner that promotes longevity, consider joining our classes at Human 2.0 right here on YouTube for free, where we help you prevent injury and move like a freaking superhero. Otherwise, as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, teach one.